Welcome to the second edition of Issues at Heart, a quarterly broadcast that looks at some of the important activities we're involved in at the American Heart Association. Today we'll be looking at the issue of access to quality health care. It's no secret that there's a presidential election coming up in 2008. Health care has already emerged as a key issue on voters' minds. In fact, a recent Kaiser Family Foundation poll found that next to the war in Iraq, health care is the most important problem for the government to address and the issue that most Americans, both Republicans and Democrats, would like to hear the presidential candidates discuss. At the American Heart Association, we could not agree more. The Census Bureau's 2006 figures on poverty and health insurance report that the number of uninsured Americans rose for the sixth straight year to 47 million, the highest number in recorded history. To put this in perspective, that's greater than the cumulative population of 24 states and the District of Columbia. Clearly, this is a growing problem that must be addressed, and the American Heart Association is doing all we can to make that happen. In fact, we recently joined forces with the American Cancer Society and 3 other organizations to raise awareness and encourage presidential candidates to address this #1 domestic issue facing the U.S. This collaborative advocacy initiative is called Are You Covered? Millions of Voices for Quality Health Care. Are You Covered represents millions of people across the United States and addresses 4 main principles: quality health care for all, health care that is affordable, health care that is without the red tape, and health care when and where people need it. It's an initiative that could make a huge difference in the lives of nearly 15.9%, or about 47 million Americans who are currently uninsured. Many of these individuals rely on medication and treatment to deal with health issues and maintain their quality of life. Unfortunately, some medications can cost as much as an average worker's paycheck, so they have to choose: put food on my family's table or get the medicine I need to stay alive. No family should ever have to choose between an empty pantry and an empty medicine cabinet. These are the reasons why we're working each day to encourage political contenders to make this healthcare crisis a major focus of their 2008 campaigns. And we won't stop there. We plan to hold leaders accountable for their commitments once they're in office, and finally put an end to the health care crisis in America. Now let's hear from some of the volunteers and employees who are working each day to bring attention to this issue.
My wife was laid off from her employment after 21 years in April of this year, and once she was laid off, we had to pick up the COBRA insurance. The COBRA insurance is costing us currently about $750 a month, and that, of course, doesn't include the other health care expenses that we have, which are medications, doctor visits, and that sort of thing.
The motivation to become involved in the Are You Covered campaign is because I'm listening to a lot of presidential candidates talk about their health care program. And we seem to be focusing more on the uninsured, or those people who can't afford insurance. And my husband and I have insurance through his employment, yet we find ourselves struggling because of the money that we need to put out for the co-payments, the premium itself, diagnostic testing that as a heart patient I need to have on an annual basis, to the point where we have had to refinance our home after having the entire home paid off just to take care of those medical costs over the last 5 years. The middle class has become the working poor. I think they're starting to listen. I'm hearing rhetoric that's starting to say we need to focus on the middle class. We need to look at what the middle class is doing, or the underinsured. Just because you have insurance doesn't mean you're totally insured.
The current system is not sustainable. We need much more public discussion to prepare us for the kind of major changes that will be required to fix it.
Since the initial kickoff, all of the people that have been involved with access to care have been attending various political events, have been going to the campaign rallies of the candidates, and have been asking the critical questions of the candidates. What are you going to do for health care? How are you going to solve the problem that many Americans have? How is your campaign going to make a difference over somebody else's?
The events basically consist of an individual who has been trained about the issue and shares the campaign's initiatives, and they attend the events expecting to be able to share their stories and ask questions about the things that they are very passionate about. Rather, they've been a victim of, due to one of those unfortunate circumstances, having health care that's affordable, accessible, adequate, or with administrative simplicity.
I think with the major organizations that are involved, the American Heart Association, the American Diabetes Association, the Cancer Society, the Alzheimer's Association, and AARP, I think that the number of people that are getting out there and bringing up these questions to the candidates is going to make a big difference in the presidential politics coming up.
Well, the advocates I work with, they now see that by participating in this particular campaign and attending candidate events across our state, they do realize that it forces the candidates to talk about healthcare reform and the importance of quality health care that's affordable and accessible to everyone.
I think the presidential candidates are listening to the Are You Covered campaign, because I see and can hear a difference in the answers to the health care questions.
Early results of the healthcare debate in the presidential campaign show promise. We are seeing more proposals, more details, but we need to see yet more information to really help flesh out where the candidates stand.
One catastrophic illness, whether it's cancer, heart disease, Alzheimer's, can wipe a family out. If I could sit down and speak one-on-one or to all the presidential candidates, what I would like to say is look at your policy for health care. It could be affecting a husband, your child, your mother, your father, or someone else that you hold dear. I would also like to say your policy is important, but your leadership is important, because the best plan in the world isn't any good if it just sits on the desk at the Oval Office.
We must make health care for all Americans a national priority and put an end to this crisis. Thank you for watching.